institute our community education. We are partnered with the University. We are partnered with the Minnesota Department of Health and Human Services. A webinar entitled Making Work a Part of Your Plan. This series is typical beginning of the webinar will cover a variety of topics around employment support and services and policies in Minnesota. Today's webinar entitled Using Data to Understand and Plan for Employment Outcomes for measure or collected ways to help us make decisions. How do we know where we're going if we don't measure it? How do we know if we're doing, if what we're doing has an impact? In Minnesota, we are using data in the way we understand where we are today and making plans for where we want to be. Please subscribe to the webinar. Thank you.
Thank you, Jeffrey. This is Kelly again, and again, thank you for joining us. We have a few session objectives before I introduce our speakers today. Jeffrey is just stepping aside so Derek can join us. The first session objective is to recognize the importance and value of data tracking in employment services, about how do we better understand connecting employment outcomes from data and tracking to help us improve our employment supports and services, as well as sharing new data applications around employment and day services here in the state of Minnesota. And I'm very pleased to introduce two of our speakers today, MaryAlice Mowry from the Disability Service Division and Derek Nord from the Institute on Community Integration here in Minnesota. Those of you who have worked in employment services and supports have hopefully met Derek and MaryAlice at some point over the years, and they're going to be sharing a bit more about their work today.
Well, thank you, and thanks for being patient. As technology is great when it works, and we thought it all worked, and then of course it's time to start. So here we are, it's time to start. We're going to talk today a little bit about data, data dashboards. They're all focusing on employment outcomes and looking at our services. We have been at the Disability Services Division, we have been working with counties since last year in their lead agency reviews, beginning to share data and information with them about their employment goals and their employment outcomes. And in this process, we've developed a framework as a resource guide, kind of an outline in terms of important things to think about. As we all know, we're in the midst of systems change. There's a lot of things that are changing, and what are some of the starting ways to go forward? So when we talk about the data today, we're also going to weave in this framework, and it's a good guide for all of us in terms of how we look at what we do and how we can do it better. So starting points for today: setting a firm expectations and roles. How's employment planning and competitive employment, and what's our expectations and roles in that? Analyzing and using data. Setting baselines and measuring improvements. And we could do that in a lot of ways, but set a baseline, measure improvement. Embed benefits planning and education. The notion of talking about benefit planning, and that's a part, and where the resources are all fundamental to competitive employment planning. Making employment a part of the plan. There are many times employment is talked about, but it's not a part of the plan. It's not a part of the person's plan. It's not a part of our agency or the system's plan. And developing and increasing capacity for employment services and supports. We know that we need to look at new ways of supporting and providing services that help people to find and keep jobs. And we also know we want to increase our capacity. Building early work experiences for youth. We want to focus on what is it that we are telling our youth with disabilities today about how they do or don't fit into the workplace, and how do we build work experiences early. And the biggest takeaway that we talk about is try one thing, do it. Many times we're in paralysis almost about what can we do, and we're overwhelmed. And so policy planning and data are ways that we think can really help in terms of helping us to know what's the next thing to do.
And in Minnesota, to put some of this work that we're going to talk about today into context, that Minnesota's getting its hands into the data world in a variety of ways. It's woven into the Olmstead plan. It's part of a much wider dialogue within our state services as a result of that. In addition, person-centered planning, a key element of that is data, the National Core Indicators data. So data are becoming a more and more important element in our ongoing systems change. I'm not going to dive too much into this stuff, and I want to provide a little more, a little just maybe logistics today, and just to ensure that we are respectful of your time. We're going to dive into some live data here in a little bit, and it would be good. We want to provide some opportunity at the end to at least accommodate a few questions if possible. So we're going to go through some of these early slides a little quicker, so we can dive into that, so you can see what the data are telling us.
So when we think about affirming expectation and roles, we are working with counties in terms of a competitive employment goal. It's a part of what we call affectionately our Olmstead Fair Share goals. We all have a role in this. This is everyone has a part in how it is that we can, for people who are saying they want a job and they want to go to work, how can we support them? These dashboards that we're going to be talking about today are a first step. They were developed to support lead agencies in their planning, and we're looking at all of the other ways in which they could be useful to all of us in terms of how we begin to understand what's happening. And the other step about these dashboards is that we've been giving counties their own earned income database, which is a lot of data. And so the dashboards are a way that we can help to manage a large set of data.
So what is it that is included in what we'll present today? There's a number of key elements that are important to understand as we present data, these data in particular. First, the group that we're talking about are home and community-based service recipients. There's about 51,000 represented in the data that we'll talk about today, and this includes 18 to 64-year-olds, those using that are on accessing disability waivers, and those that are using a variety of mental health services, including
ARMS Act, mental health targeted case management, both youth and adult, and then medical assistance for employed people with disabilities, MAPD. And
the purpose of many of these dashboards is really to start providing a baseline of that the Olmstead plan around the area of employment has been seeking. And I think another kind of secondary purpose is to start a dialogue where the state, all of us within the system, at every level within the system, sees their place in how we're where we're headed and where we want to go. So the data are made up of are pulled from a few different places. One from the MMIS and the Maxis systems, and MaryAlice can go into detail about what those are.
So that is our databases that are used in terms of home and community-based services and Medicaid service utilization, and Maxis is the database that financial workers used. So we married the financial, our earnings, employment, where we get that data, with where our service utilization data, and we also then went to our UI, the unemployment insurance wage database, so that we could check and see if the data was good. And I'll let Derek talk about that. The one other thing about the data is the data that we're looking at today is state fiscal year 14.
Mm-hmm.
And we're getting ready to do 15 in the next couple of months.
Mm-hmm.
So making the data more meaningful, and it's for all of us. We've worked really hard with Derek and ICI in terms of how do we present data in a simple way, and what's ways that we can ask questions. And we'll keep reminding ourselves and you, this data is information, but also what this data is in a lot of ways is it provides information so we can begin thinking about and better asking what's the question to be asking. The data not necessarily is the answer, it brings you to the next question. Yeah.
So as an evaluator myself, data are a key piece to making decisions. And to me, I think piggybacking off of what MaryAlice just said, there's a tendency to use data, and particularly data sets and quantitative data, such as you'll see today, as the answer. And I would just caution all of us, that isn't the point of what you'll see today. The point of today and the point of these data are to provide a slice of a much bigger picture. And I think that's critical, because I think that we tend to go down a path of judgment of good, bad, based on one piece of data, and that is what we want to pull you away from that tendency. So the role of this is to start a dialogue, and understanding that the state is undergoing these systems changes, and it has set forth a direction that it wants to provide opportunities for the competitive workforce for all people with disabilities using services. This is meant to provide a starting place, so we know how we're doing at that. Another element to what you'll see today, but also in using data, is making this meaningful for you. Depending on where you are within the system, if you're a state agency, if you work at a state agency, a county, if you're a provider, if you're a person with a disability, data and how it's used, or how it's presented rather, how it's aggregated, may be more or less relevant to you. So the purpose of what you'll see and what you'll be able to engage in at some point is are data that allow you to dig into the questions that are going to be meaningful for you at the level that you're operating and influencing. And I think that's important to understand. So again, as an evaluator, I tend to think of evaluation in kind of three kind of simple steps in an equation. It requires a goal, or kind of a direction, or some type of place that you want to go. It requires data, so you can then determine whether or not you're headed that direction, or to what extent you're heading there. And then at some point, some type of judgment call, some type of evaluation of, did you get there, and if so, how well or how much did you get there. Again, this is meant to be one slice of a much bigger, I think, evaluation kind of puzzle that needs to be put together. But it's an important piece, and a good place for us to start as a system to start asking tough questions.
Okay. Here's the first little glance at what the dashboard looks like. There are we start out dashboards with the whole state. They're interactive. The colors going from green to blue donate different. So we just wanted to give you a picture of what the first kind of what you're going to be looking at live in a few minutes.
Yeah. And we'll give you a couple other examples here too. Here's another example of what a dashboard will look like, or that you'll see in a minute with live data. And again, you don't have to get into the details here because we'll get a little more detailed with the live data. But what I want to highlight here are visually what you see are a color gradient that represents different earned income levels. You see a variety of services, employment and day services categorized there. You see all the way to your right a series of percentages that add up to 100, and the total group here is of about 51,000. I'm sorry, this is of just waiver recipients, so it's a smaller group, about 31,000. We'll dive into this soon, but the idea here is to start providing much more easily accessible and understandable ways to look at our complex data in a way that's meaningful to understand our employment and day service delivery system.
Yep.
And here's just another example of the same the same slide as the previous, this time highlighting maybe just one way that you might engage in these data. It might be, for example, here we're looking at MAEPD, what's highlighted at the top. People that receive medical assistance for employed persons with disabilities, but then also receive supported employment services, supported employment and day training and habilitation services, and supported employment services and pre-vocational services. And what you can see based on the visual is on average, the earnings are higher, denoted by the darker orange there. But you can also see the percentage of all of the service recipients in home and waiver services that actually access those three types of service arrangements, and that is less than 3% utilize that unique arrangement of services, at least in fiscal year 2014. So this is one way that you can use the data, is really start identifying key questions that may be of interest to you.
Yep. So that this whole thing of making work part of the plan, and the dashboards are meant to really be useful in helping sorting out questions. Who do we talk to about employment? What services do they receive? I mean, beginning to look at what is capacity.
And again, kind of going back from that to that first dashboard, again, that we'll present here in a second, you can see highlighted here, thinking about what MaryAlice just said of how do we make work part of the plan. Well, maybe a question is, how are we making it? Are we making it part of the plan? At least in service, is service utilization being woven into that plan? And here, what you see highlighted are the group of people that are not receiving medical assistance for employed persons with disabilities, and also not receiving supported any employment or day service. And what you can see, if I kind of draw your eye all the way to the right of that box, is almost 50% of the approximately 31,000 waiver recipients don't even receive any of these employment incentives or employment and day services.
Okay, this is a prime example of a place where it was very easy for people to jump in about what this meant. This no SES, DTNH, or PVS at almost 50% doesn't mean, oh, why aren't those folks getting that service? That may not be, that may be a question, but the assumption should not be that every one of those people should have that service. But there are other questions that we can begin asking and getting answers to, maybe through this data, but also in other ways. So we have to be cautious about this data does not tell you the answer at first glance.
And I would just reiterate that I think that is the most important, one of the most important takeaways here is that's a number, and there's a lot of stories that make up that number, and we cannot assume that we know what that means. So what it should do, if I were working at a different level within the system, is start asking and inquiring within the system that I operate. Why, at what extent, how big is that number for us, and why is it big? There are going to be a lot of reasons, and I think what's important for everyone in the audience is not to dive into the judgment that that is a failure. I think that's critical.
Right. And in the conversations that we've been having with counties, you know, what we are starting with is where are there pockets of something's happening well? Where are the successes? Where are these relationships that they can build on? What are the relationships across counties? What can we learn from each other? And so the data, once again, we just can't say enough. The data is not meant as this barometer around your performance. Of course, the data is what it is. So now, where is it that we look and where do we find pockets where we can really develop and increase our employment services and supports?
So we'll dive into this dashboard in a minute live, but it's just another way to slice some of, well, the same exact data. And how we're slicing it here is to take a look by age group. That's the column on the right. You see a variety of age groups, 18 to 26, 27 to 39, and so on. So each of those bars represent a specific age grouping. And then color-wise, the colors are meant to denote those that receive, the blue is those that receive supported employment services in some way, either just by themselves or with day in training, habilitation, or pre-voc services. So supported employment alone or with other services. The middle grouping is no supported employment services, and that last grouping is no day in employment services. So what it shows is by age group across the state, this particular dashboard across the state, at what percentages are accessing supported employment services with or without some other service and the other types.
Yeah. And here's another look, another view of the dashboards. Is this also, you know, now we're looking at columns with the ages. The blue is supported employment only or with DT&H or pre-voc. The beige tan in the middle is DT&H or pre-voc services, and the green is no day services. And this shows your earnings. So, I mean, what we can say about this is the individuals that get supported employment have higher earnings. Now, there are more things to ask, and there's more things to find out, but that is what this shows us with the data.
And there's definitional challenges too to the data, and that we rightly admit, and everyone out there who works who's providing services and supports probably understands, is that definition of day training and habilitation and supported employment services. Day training and habilitation doesn't restrict you from providing competitive employment. So again, I think the devil is in some of these details, and it's something that we recognize. But again, services and how they're defined, that's a different and a different question. Currently the way our service delivery and how they're and what's actually being billed to Medicaid, this is how it lays out with wages. So I just want to recognize some of the definitional challenges also.
Right. So here is our next, we have another dashboard which is looking at the percentage of home and community-based service recipients. So this is our 51,000
Yep.
that are in the current dashboard for the database for state fiscal year 14. And the blue is a higher percentage, the green is lower, and when you go to a live link, it's also interactive.
Yep. And what this is attempting to tell, and what you'll see soon, is the percentage of people employed by a community business that is not a provider. And so the darker the blue, and the blue means it's over 15% and further away from 15% higher, and green and darker green means it's below that 15% and further away.
Okay, so this is what it looks like. I want to do a few little definitional things. When we say service provider on here, this isn't any service provider. This is a service provider, day training and habilitation, pre-vocational or supported employment service provider. That is, they are the entity that provide a paycheck to the individual who is employed through their services.
It doesn't include PCA services, personal care assistant services. So it doesn't include that provider group because that wasn't the purpose here. And community business here, and let me just, I think another definitional piece is, it's difficult to know, or it's impossible to pull out of the data somebody who's employed by a provider in a competitive job versus, so I know there's a number of people that, and I would argue probably not that big of a percent. It's probably a very minimal percent, but there are a number of people who are employed competitively by a service provider they would have been bucketed here in that service provider group rather than the business not a service provider. So I think there's, again, a little definitional thing, but again, I don't think that percent is that high. But what you see here are, and just a quick snapshot, is the number of people, of that about 51,000 of home and community-based service recipients, only about 22,000 have earnings. Of this group that had earnings, you can see on the right there, highlighted are their average and median monthly earnings as reported to their financial worker. So we'll go into this in a moment.
And then we just wanted, in terms of looking at the data, we, one of the ways in which you can slice the data, if you will, is by age. What we know is building early work experiences for youth really make a difference. Youth are 4 times more likely to get a job post-graduation if they had paid work experiences while they're in high school. And how can this data help in planning ahead for transition from school to work? And so that's something that we're also been keeping in mind. The last part of now we're going to go into the live data, but this is the piece that, we want you all to be thinking about is, what's your first next step? And how will you, what step will you take to make work part of the plan for people?
So we're going to dive into some of the live data right now, but I think as we do, Kelly is going to gather questions. So I recommend shooting questions by way of Kelly. Is this through the chat box? So if you have any questions, we can't promise to get to them all, so know that. But please, if you have questions, it'd be great to hear them. We'll make sure we allot some time post or after this to ensure that we allow some questions. So let me just pull this up here. And we are operating, by the way, folks, online, so we're hoping that this, of course, the technology works. So I'll let you kind of...
All right, so this is the first dashboard that that was developed, and this is looking at waiver recipients. So the DD waiver, CAC, CABI, and BI in state fiscal year, and this is our interactive map. So,
and this is showing the percent within each county, the percent of waiver recipients that utilized in fiscal year 2014 utilized supported employment services.
Mm-hmm. Now, I know one of the questions is going to be, when can I have this? And this is I didn't have to wait for a chat on that. We are right at, what we are doing right now is we are beginning, we're in process of distributing these links to counties. And all counties will have their links within the next 4 to 6 weeks, if not sooner. What we are then going to be looking at is where can we make, particularly this dashboard first, we are going to look at a way of where it can be on the DHS public site, so that, as a part of, and we don't know where it'll be right yet. We've talked about putting it along with our data that goes as a part of our waiver reviews. But we are in process. Counties are beginning to get their data, get links to this, and hopefully using it. But here we are. So you can look here, you can see we're at St. Louis County, and 7.18% of waiver recipients 18 to 64 are using supported employment services.
In fiscal year 2014.
Right.
Yep.
Mauer, I'm going to Mauer in the morning. They already got their little database, and they have their dashboard link, and they have 9.3% of their folks. I was just at Freeborn last week. Freeborn 1.70. So, you know, they already are asking questions. A good question for Freeborn is what's happening in Freeborn versus what's happening in Mowry? Or better yet, what's happening in Wazeeka at 25.25%. So this doesn't give them an answer, but it certainly helped them to ask a different kind of question and to maybe have a different kind of conversation. So let's go to the next part, which you saw something that looks like this. So this we have definitions, you know, give you a little bit. 31,903 people are in this database. And we could go to counties. So, you know, you can drop down and you'll see all the counties. Right now we're going to stay statewide. You can go to age. There's a drop down. Oops, see, and then your waiver. And then residential settings. All ways to ask different questions, and mental health services. I don't know what mental health.
Oh, right there, yep.
I know.
Oh, you're clicking on the filter. Click on the,
Uh-huh.
and there's the.
There we go.
So this would be people on waivers that also used mental health
Right.
services in that fiscal year.
So you want to,
Yeah, so
Give it a
let's
little-
just give a quick tutorial here. So there's, like MaryAlice said, there's a variety of filters here. So imagine being somebody working at the state and you want a state picture, and what you have an interest in here is maybe a question around a specific waiver group. So let's go to the DD waiver, the developmental disabilities waiver here. So you can see I selected that one filter, and this filtered out a great many of the data. So of that 31, if you see up here where my arrow is, about 30, like I said, about 32,000 people are utilizing waiver services. Well, of those, only 13,000, about 13,500 people are on the DD waiver. And so this is their data of that group. And what you can see is that here's the medical assistance for employed persons with disabilities, and all of those using the types of employment and day services that were utilized by the people that are utilizing the DD waiver. And then here down at the bottom here is those that aren't receiving medical assistance for employed persons with disabilities, and the services. The color gradient, as I said before, shows where on average, the higher earnings are being earned in certain services. In particular, you can see supported employment services. Those that just use supported employment services and medical assistance for employed persons with disabilities earned on average monthly $592, compared to down here, those that didn't use any of these services or MAEPD earned on average $89.
all right, so just to give another little example around how in the kind of conversations that we've been having in these employment discussions. So maybe a question that comes up is, well, what about people that are in corporate foster care? So we could click on corporate foster care. I'm not nearly as good. So statewide, so we're at 13,500, and now we're at about 7,000, a little bit under there. And, we're seeing some of the same picture, little bit difference. And this is the average earnings of the entire group. So this includes that's the average earnings. And you can see as we've been going around with our pointer, that this is, well, let's do one up here. So here, not only do you see the 402, but it shows, well, this is no day service who are on MAEPD make an average of $402 a month.
And that group
No,
is made up of
right.
3% about.
And so this is another thing in terms of thinking about work incentives and benefit planning. There's some things that we know. People on MAEPD either are on SSDI or they have not been determined disabled by Social Security. And if they were on SSDI, that means that they had work credits. So they made enough work credits. The other group, though, that's on MAEPD is that they are on survivor benefits. So their mother or their father had work credits. So we can't generalize here, but we know some of these folks here have had some work experience. And on this group, this is folks that are on SSI. Or they're on SSDI and their check is so low. They're always, see, in benefits planning, there's always another if here. Or they might have been on SSI because their SSDI check or their RSDI check was so low that they qualified and they didn't have to pay a premium on MAPD. They just were getting that. So there are lots of things here. We're going to go to one last look here on this dashboard, and then we're going to move on to the other one.
So this is the dashboard that looks at the same group, waiver recipients, but by this time it cuts the data by age.
So we're beginning to get a visual here that shows you about age, and this is supported employment, this is pre-vocational or DT&H service.
With no supported employment.
No SES, and this is none of those three services. Now, we don't know what else. We don't know this data doesn't tell us anything about any other waiver service.
Mm-hmm.
So this is the thing of what's the next question here. And then down here, we have a different way of looking, and what we said to you here is this change, and let's look here. So you see, we've got, I think the researchers call this a bell curve. Is that right?
No, I wouldn't call that a bell curve.
No, they don't. No, this unresearcher didn't, but I want to go to we've got the age there. I want to go to,
I'm going to take the mouse away from
she's
MaryAlice.
going to take the mouse away from me because I'm not doing well. But I wanted to show just in the waivers.
Oh,
let's break down the waivers a little bit. Let's go to CADI.
CADI waiver. There we go. So here's
All right.
CADI waiver only.
So actually, the earnings are a little less in supported employment, but the ranges are, but it's basically the same story.
It looks like there's more people, a greater percentage than this is higher than the state average for the number of people using supported employment services. You can see for 18 and 26-year-old group, that was about 9% for the whole state. Well, this is 14.2%. I would say that's a marked difference. It's higher for the younger ages here. That sticks out to me.
And the other thing is that some of the differences between using DT&H and supported employment, and that's where when you get to your county and break down, and we're not going to do that today.
But those are points of discussion that you have with your county as to, I think the context, many of you out there have the expertise and the knowledge of why some of these discrepancies, or why did the day training and habilitation come closer to those earning on supported employment services. So,
all right. So here in the DD waiver, we have the same pattern and maybe even more distinction here.
it appears so.
Yeah. So we're going to go to we're going to go to the employer of record dashboard.
Right, so a difference now. Now we're switching gears just a little bit. So those previous dashboards really dug into waiver recipients only, people receiving waiver services. This includes that group, but it adds on there a much bigger group that includes people that only receive mental health services. So some people with mental health services and waivers that receive those services were in the previous group, but there's about 14,000 people that only receive mental health services and no waiver. So this is the aggregate on that, and it's approximately 51,000
And
people
then we
total.
have another group here that's a little over 10% of the whole, that's MAPD onlys.
Yep.
Yeah. So this is
Thank
the
you.
same thing. So Cook County, 19.5% of the group have their, a job of their own. And
Employed at a community business that isn't a provider.
and then St. Louis is 12.32%. And you can see,
There's a dark blue pocket right in the middle of the state there. 21%, Benton at 21.5%, so you can see there.
and yes, and these counties are beginning to talk to each other. Like this whole group over here are now, they're communicating with each other to try to understand what it, and you know, many times this data is not counties with their providers, they know the situation and they know the data. I do want to say that we shared this data with representatives from MORE, and we also, the Association for Employment Providers and Day and Rehab Providers. We also have shared with a number of counties, not only individually, but as a group. And we're beginning to, and this was a part of sharing, we're beginning to let more of you see what we're developing.
Well, and help us understand too. I think, it's easy for me to sit in my office or in this room and declare what this means, but I think really it's more powerful when we come together and understand what these data mean and what this looks like on the ground.
Right, and people have, by and large, they absolutely see earnings. They absolutely agree with a lot of this. And I think where folks have been very appreciative is in understanding how they can, use these little by county, by region, by provider, how we can begin to look at what the story is.
Right, so we provided an early staging of this particular dashboard. This, again, it looks at the number of people within each of these groupings, but you can see the groupings here, and I'm gonna go column by column. The first column all the way on the left are whether it breaks people out by those that had earnings and those that didn't have earnings. You can see 22,000 approximately had earnings, almost 29,000 had no earnings of this almost 51,000. Then from there, those that had earnings, breaking it out, those that were employed by a community business that wasn't a service provider, those that were employed by a service provider, possible service provider. There were some unknowns in the data set. These are human entered data, and being able to understand and put people in the appropriate buckets when it wasn't clear, caution was taken, and that's where you see some of what I would say is error at this point until we can confirm. But I would say that's an error rate of approximately 5%. And I just wanted to be transparent here. Possible service provider, unknown, and none noted at that time analyzed. So we pulled them out and put it out there for you all to be able to see. But of those, you can see of the total group here, there's about 15.6% that are of that about 51,000 that are employed by a business that is not a service provider, and 23%, almost 24% that are employed by a service provider.
So then we have average monthly earnings, and we have the median. And that means 387, we all, average is an average. You take the whole number and you divide it. Mm-hmm. And this one, half of the group here make less than 387 and half make more. Now, we did ask a couple of providers if we could use their data. And I think we'll give a little snapshot of this for you.
Again, this is 2014 fiscal year, so,
And, but mainly we want to show you not so you can, so you can see what can happen with with this dashboard, because it's pretty, there's some features of this that really are useful. There's one big thing that I didn't say, and neither one of us remembered to say, and that is when we talk about the county, we're talking about the county of financial responsibility. So we know that there would be some differences if what you were looking at is your county of residence, but we are talking about which county pays for your service. All right, so this is LifeWorks. And LifeWorks in state fiscal year had 585 folks.
thank you, LifeWorks,
Thank you.
for allowing us.
And thank you, LifeWorks, for showing us. 29% about have no earnings at all. I wanna, this is another aha, don't like, oh no, why aren't these folks working? The question is what are the other programs that they have at LifeWorks during the day that people are involved in? There may be community, socialization, there are lots of other things that are happening, what kind of recreational arts, training of different sorts that, so a third of the folks, a little less than a third, they're doing something else during the day. What they have is 20, you want to?
Right, so what you see here, the two columns, of all of their service recipients, approximately 16% are employed by a business. Now, of those that have earnings, that number changes to almost 23%. So of those with earnings, about 23% are employed by a business in the community, and about 69%, 70% are employed by a service provider of some sort, probably LifeWorks.
Yeah, and so with the service provider, I mean, and when we've talked with providers as well as county, it really is. And we know for LifeWorks that they're very much engaged right now in what are other ways that they can look at their business model. How do they move? What do they take opportunities? So this is very much tuning in to, this is the whole, and it's something to measure by over time. For counties, one of the things that they really like is when you go to LifeWorks, this shows all the counties that are the county of financial responsibility.
Of those 585?
Of those 585. Counties went, wow, I'm so glad to know this. Regions, here's all the regions. So, you begin, and it also begins to show the complexity
Right.
across the counties and with all providers. And then, of course, you can do this, the 585, if we wanted to just look at their DD population.
And something that you'll notice that I haven't mentioned yet, and it may pop up here, is when the data cell, when the cell meaning each of the little areas where a number exists on this table, when it falls below, when the number of people that are represented by those data fall below 5, the cell goes blank. So you won't,
Yes.
just to ensure some the
Right.
anonymity of service recipients.
So we're going to turn to questions now, but I mean, here's something. We had their total, and so primarily LifeWorks, the people that they serve through Medicaid funds are on waivers. So we're going to do some questions.
And on the developmental disability waiver.
And the
And that-
DB waiver.
yeah.
Yep.
So we have a couple questions we're going to take right now, and then we're going to stay on time.
So hi, everyone, this is Kelly. Thank you again so much for joining us. And Derek, if you could bring back the PowerPoint slides
Of
up
course.
with your contact information, yep, right
yeah.
there. And I'm going to read a few of the questions from the audience, which have been very helpful. So right down there at the end, just so you can see it. So there's Derek and MaryAlice's contact information. The last slide that we have there as well, we want to make sure to thank our partners at the Department of Human Services who have created the opportunities to have this webinar series Make Work part of your plan. So I'll share a link with you at the end here, but there have been a couple.
And these data.
And this data as well, yeah. So the first question is, hopefully a quick one, is when will the 2015 data be available?
We will be finalizing the big database for state fiscal year 15 the second week in July. And then we are hoping within 45 days that we can shift from the big data to the dashboards.
Excellent. Derek, this might be a question for you too. How many hours can we assume that individuals are working in a month? Is that one of the features within the dashboard? Because you say, oh, somebody makes $500 a month, but maybe they're working a lot of hours versus somebody who's making less. So is hours available, or do we have any information about the average?
That's a great question. Actually, I'll hand it off to MaryAlice.
Well, the short answer is no. You cannot make assumptions about the hours here. We have gone and we did review, we randomly selected over 400 Maxis files, individual records, to look at the earnings documentation. For people that have a job in the business category, they have a job that's their job, not paid for by their provider. You could go in and look at these individual records and get hours. Right now, this is a big question at the state in terms of our Olmstead reporting and understanding more about employment in general, and we're working on what are some ways that we can address that.
Yeah, but I think just to reiterate, what you see up here, there's nothing about hourly wages. There's nothing about hours woven into here, so nothing can be gleaned from that, because it would be inappropriate to do it based on what data were available.
The next question here is, have legislators seen this data? And if not, does DHS have a plan about how this information might be shared with legislators in terms of sort of which services are being invested in?
The legislators have not been, we have not shared this data with them right now, and those conversations are beginning to occur.
Excellent. You did show us here, because one of the questions was, can we see a difference from provider to provider? So it looks like you can, Derek. You showed us a little thing where it listed all the providers. When counties look at the individual data, will users be able to have the ability to say, here's provider XYZ and here's provider ABC, and look at differences between them?
The dashboard itself allows you to combine providers. It doesn't give you 3 in a row. So you would have to do some work yourself.
Right, and let me just rephrase the question just in the event. It sounds like, is it possible to look at one provider on the dashboard and then pull up and compare the data to another provider by pulling that? So it is possible to compare. I think the intention, I'm going to pass that off to MaryAlice. So.
Well,
that isn't the intention. I can say that.
No, and you can look at data. You can collect. You can also look at data from a provider from one county to another, and look and see, are there any differences? But in terms of taking the dashboard and showing them, you have to pick them.
Yeah, so this kind of ties into the next question, which was actually from a different person, and they said, how is this data useful to job seekers or to families? So if a family wanted to compare providers, it sounds like this this dashboard will not be available publicly at this point. But how would you, sort of as the folks who have worked on it, how this data is useful to job seekers or family members themselves?
So in terms of, first, the first goal in the dashboards was to provide some support to the counties in their planning. So this could be used with a case manager and an individual. And they, you know, in looking at, I think that what we need to be clear about is this only provides a limited amount of information. But, so you could say, hey, this is what I want a job, and I've heard blah, blah, blah is a good, or my friend went to blah, 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 and I would like to go to that provider too. I mean, you can show the data, but you have to have a different kind of conversation. So, what we hope.
Decisions based on this alone would be inappropriate, I
It
think.
would be
Absolutely.
inappropriate.
Yeah.
So this can help have a different kind of conversation, where you're asking more questions, where you're starting to find out more of what's important.
Yep.
Yep.
And this is kind of a multiple part question. This will be our last question here, and then I'll wrap up. Has the expense side of the equation been researched? For example, supported employment recipients earn higher wages, but what is the investment in costs in SES, and how many dollars of return on investment? And how does that compare with the return on investment of other types of services?
Yeah, I mean, that's, again, beyond the scope, well beyond the scope, I think, of these data. Has it been researched? And return on investment, I think that's always a question, and a debatable one, whether that's even appropriate, thinking about the services. But beyond the point, that is not the point of these data, and I'm not actually prepared to answer that question. But I mean, I think, again, going back to these data, the purpose here is to provide, in the dearth of data, or the dearth of information and actual kind of direction, supporting a general direction, we now have something, a story that is starting to emerge that can help, at least in really the difficult planning steps of changing our service systems. This is one key piece that can be used, and I think and it's just one piece of many pieces that need to be integrated as the state, the counties, and even providers think about how they might better respond to the employment support needs of people with disabilities. So again, this doesn't get down to that level by any stretch, but I think we're making data much more accessible and relevant to people. At least that was our hope here.
Yeah, and we really, as we begin to roll out this data, as we begin to, we have talked about having focus groups. We wanted to not wait until we had a plan all wrapped up before we took this opportunity in a webinar to begin showing what it is, some of the steps that we're taking to try to have some information about our services, about competitive employment, and about the earnings of the people that we serve. So we really thank you all for the opportunity to have this webinar today.
And we look forward to questions too. We really are open to those. You know, it's easy to dive into this and shoot us an email, give us a call, and we'd be happy to talk through some of the stuff we presented today.
And again, I want to thank everyone for their participation and patience today. I apologize for the technical difficulties. This last slide here has a link to a website that highlights the Make Work Part of Your Plan webinar series, where you can go and register for our final two webinars, one that's going to be next week and one that will be on May 31st. So please take a look at that. In the chat box, I also provided a link to an evaluation. We very much value your feedback and your comments about this session, as well as other suggestions and ideas of things you'd like to learn more about. So again, thank you so much for joining us today, and you should be able to find a recorded version of this section, or of this session, at the website, and the upcoming session, when it is posted, will be closed captioned. So thank you very much and have a lovely day.
Stop sharing. Hey, nice job. That was good.
We did, and
Yeah,
we
wow,
were
I know. That was good.
1 hour.
Nice.